Welcome to the Juice Consumer Direct podcast. I'm Carson Poppenger, and today we're going to be here talking about healthcare outreach and increasing member engagement in healthcare. And there's a lot that's been changing in healthcare as far as telehealth and everything that's going on, pre or post pandemic, the aging population, things like that. And there's a lot of need for outreach for members that are on health plans, and health plans are looking for creative ways to outreach. And so we're going to be here talking about that today. Joining me today, I have Jacob Thorpe, our SVP of Client Services and Partnerships, and James Cook, our Chief Operating Officer. James has a particularly lot of experience in healthcare, worked in a number of different companies and different healthcare functions, everything from working with Medicare programs and plans to, services that revolved around scheduling rides and things, transportation, non-emergency medical transportation for health plans and people. And so welcome, James.
Thanks.
Pleasure to have you here.
Yeah, appreciate it.
Great. And so things have been changing rapidly, as we mentioned, in a lot of different ways with healthcare. Any experiences that you've had or things that you've noticed, James, over the last couple of years?
Yeah, for sure. Absolutely. The healthcare industry's changed a lot. There's, post-pandemic COVID times, people are a little bit more comfortable doing healthcare things from their home, right? They want the convenience of, being able to be serviced in their home. And so that's changed quite a bit, So it's the healthcare industry continues to evolve, but we see more and more that telehealth is becoming a main way to connect with patients and members, and that is going to probably continue to be, a big thing as we move forward, for sure.
Yeah, it's interesting to me that you're seeing healthcare follow some of the same patterns that we've seen in the consumer direct space for services like mortgage, debt, financial services, insurance, home services, you name it. We've seen kind of the evolution of omnichannel contact strategies, so communicating with the customer when they want to communicate and in the channel that they want to communicate. So whether that's text or whether that's over the phone or chat or email, having that capability. Now you're seeing that transfer a little bit over to the healthcare space where patients are having that expectation of their service providers. But oftentimes the service providers don't have the infrastructure to have that, let's call it omni-channel approach.
Right.
So you're seeing businesses pop up and you're seeing contractors and new opportunities in this new kind of vertical growing, which is service providers who are consumer direct. And now they are doing outreach and a contact strategy on behalf of the payers and the plans in order to provide a better service and help protect their customer base. James, could you talk to us a little bit about kind of how that payer and service provider relationship works with the different rating systems and the incentives that are in place to do that?
Yeah, absolutely. It's common knowledge within the healthcare space, and especially with Medicare and Medicaid, that there's a significant focus on member care and quality of care, and that there's some financial incentives tied to those things. And so more and more you see that payers and service providers are aligned in that objective, in that goal, because there's a lot of money there to be had. And so, the more and more you see the focus of service being, really directed at catering towards the member, taking care of the member needs, and meeting the member where they are. And a lot of times that's within the home, whether that's an in-home appointment or a telehealth type appointment. So it's becoming more and more mainstream for providers to be able to provide that care to that member wherever they need.
Yeah, going back and, over the last probably 30, 50 years, that healthcare has been something where you have an issue or a concern, you go into the doctor and you sort of go see them where they're at.
Right.
And, we also know that like institutional hospitals, facilities, and things like that, those costs are just skyrocketing for healthcare plans and things like that. And so the health plans are probably looking at ways where, hey, we can actually reduce costs and treat the member where they're at and in their home, rather than bringing them into a facility that's going to incur a lot more cost and things like that for the member and for the health plan.
Well,
trying to keeping costs down.
Yeah, keep in mind too that the health plans are incentivized and motivated to make sure that they're providing services to all of their members. But there's a significant portion of the member population that is not as proactive with their health, and so that's where member outreach and the plans or the payers really being proactive about connecting with their members is so important. And having a strategy, an outreach strategy that really allows them to find those members where they are, provide services to them in person, whether that's, providing means for them to come into the office or providing services to them in their homes or over the phone in some cases, right?
There's also a large portion of members that live hours away from a hospital.
Rural population.
Populations, middle America, where they don't have, there's an accessibility issue as well. Now, these insurance plans, they're also incentivized to provide preventative care instead of care for someone who has an issue that's gotten worse and worse and worse over time. So that preventative care is an investment that they're making by making that accessible to everybody through telehealth or in-home appointments. Or I've even seen mobile clinics where they'll drive to areas and they'll have all their members come to those areas or come to receive some testing. They're able to, one, mitigate their risk, and two, provide that service to as many members as possible. But all of a sudden, instead of just having people knock on your door, you're having to go out and you're having to knock doors yourself. You're having to go out and outreach. And that's something that I think a lot of these plans and these service providers weren't equipped to do, because it's such a change in it's such a change in the mindset of customer acquisition and also member retention.
Yeah. And that's something that we've done at Squeeze over the last 5 years is increasing the number of healthcare appointments we're setting weekly. I think now we're over 4,000 or so weekly appointments that we're setting for different programs and plans. And what are some of the interesting things that we've seen in that process, James, as we've sort of added in? We've always we've always been strong in mortgage and insurance and these different consumer verticals. What are some of the differences and things that we've done in healthcare to really make sure that we're delivering the value that these health plans are looking for?
Yeah, one of the things that I believe we do really well with is provide a white glove type experience, which you can do that in any vertical, in any industry, but especially in healthcare. I think that's so important. Members want to be treated a certain way, and when you're representing a payer, a health plan, someone that wants to ensure high quality of service, it resonates really well with our clients that we can provide such a great service to them. And so that's something that we've over time realized how important it is to do really good training, to make sure that our people are knowledgeable, that they have great phone skills, that they're providing a great experience over the phone. And really it's about creating some trust right out of the gate. Because especially when you're talking about healthcare and a member's engagement with a health plan, that's so important that they feel that they can trust that person.
Mm-hmm.
There's also security risks associated with anything in healthcare, making sure that you're trained on HIPAA, that you're SOC 2 certified, that there's data security. I would not want to work with anybody that didn't have their ducks in a row on that front, because that's something that when you do a SWOT analysis of your business, it's always a threat. It's especially nowadays. So ensuring that we have a very extensive HIPAA training that we do with any agent that even touches healthcare accounts. There's all sorts of processes that we've built to ensure that our scripting is only populated when we have member verification, that we're speaking to the right person, and if we're not, that there's power of attorney. I mean, we have all of these things that we do to ensure that we're following the correct protocol, because these, a oftentimes what we're doing is we're doing outreach for the service provider, not the plan directly. So how it will work is the plan will have a service provider that they send member lists to in order to provide essential services for those members. It could be preventative care for diabetes. It could be bone density scans. It could be eye exams and things of that nature that help them measure risk. And essentially, we're representing that service provider to the plan. Those plans secret shop like crazy. I mean, they are always testing their service providers to ensure that their service levels are being met. Not just their quantitative service levels, but the customer experience and compliance.
Yeah, and I think that's where Squeeze has done a lot to make sure that the quality is high. These conversations are white glove, so we're measuring that quality through QA efforts that we have going on every day, every week, and really that our standard is high. In the healthcare space, in that industry, typically you're going to see 90-95% quality scores across the board, and so we've taken that same approach and made that our standard. And obviously, that's really helped ensure that trust is there with our clients and their members and the customers that we service.
Yeah, there's certain challenges with the outreach as well, right? Where the members are in different areas and there's service providers that cover those areas, and reaching those members and scheduling an appointment that works with the service provider schedule and all that, their routes that they're on, all that kind of stuff, especially in those rural areas. What are some of the challenges, James, that we've dealt with or handled with relating to that? And how do we mitigate those things?
Yeah, I mean, logistically, some of that is really challenging when you have limited service providers, members who are spread out. I think it just takes really good coordination between our team and those scheduling, those routes that we can schedule for, and our clients' teams, and ensuring that there's great communication there. It's really proactive, that we are talking regularly about that, and ensuring that the feedback loop is strong, that we're helping them understand where there might be challenges and how do we overcome those, and just being really proactive with that. And that helps us to ensure that we can consistently provide the service that we need to provide and perform to the level that we want to perform.
I was just going to say, for a lot of our partners, we are literally operating as their outreach machine. Like, we are an extension of everything that they're doing internally. And I would say more so in these cases, there has to be that back and forth partnership.
Absolutely.
Because things move so quickly and so rapidly, and schedules get filled so quickly. So automating as much of it as possible, and then having that feedback loop is really, really important, because we're not just managing the service levels for the service provider or for our partner, but we're also trying to help the service provider match the metrics for the payer, which is how they win more business.
Well, and kind of to jump off that topic, but having the systems in place that allow for that consistency. We've seen show rates with our appointments we've scheduled in the high 70s, low 80s, and better in some cases. But that's just a testament to how strong the approach is and the systems that are in place. And like you said, Jake, the ability to give feedback and communicate pretty regularly there.
Yeah. When you talk about 15,000 appointments a month with service providers that are spread out all around the country, it really is kind of interesting to think about the logistics that go into that, to making sure that that those service providers they're not overscheduled or overbooked, and that they're also not underscheduled where they don't have any work to do.
Supply chain nightmare.
Yeah.
Right. But it's like each part of your supply chain also has opinions and personalities and and things that you've got to manage outside of just their ability to perform the job.
Right.
It's not easy. The recruitment for those for those caps or those people who are going in and doing in-home visits is a whole nother piece of the business that's very difficult to manage. So making sure that the appointments that you're scheduling have good quality is a great way to improve the consultants' retention and reduce their turnover.
Yeah, and we know that like this population that we have of aging seniors and their increasing healthcare concerns and things, there's just such a big gap here and opportunity. And every time there's a challenge, there's an opportunity to provide additional services and for these members and these people that want to make sure that their healthcare is looked after and that they have the things that they need so that they can stay healthy.
On that point, there's a significant portion of the population that isn't going to proactively go and take care of their own health needs. Mm-hmm. And so that's where a service like ours can come in and really help a payer, a health plan, kind of close the gap on some of that challenge there, that we can do the outreach, we can connect with them over the phone, we can make sure that they know that somebody's looking out for them and that there's a service that can be provided, and really help them with their healthcare needs and be proactive with that and prevent some of that healthcare challenge that might happen if they don't proactively take care of it. So.
Yeah. I was just going to say something else that's really, really important with this is these service providers have multiple payers that they are usually working on behalf of. And each of those payers has their own unique requirements, scripting, compliance, quality, and different metrics. And so you need to utilize a partner that's able to have dynamic processes to match the needs of those payers. Otherwise, you won't be able to win the business, because that's actually a pretty complex setup too. When you've got 17 payers in different regions around the country and they all have their own script and different scripts depending on the area that you're operating in and the state that you're calling for, you end up having hundreds of scripts that your agents need to be able to execute on and they need to be trained on.
Right.
That's a lot of plumbing. It's not easy to execute on, but we've got a great system for it now.
Yeah, what kind of, just thinking too about the kind of KPIs that the partners that we're working with, that they're looking at, what sort of KPIs should they be looking at, James? Like appointments booked, patient lifetime value?
Yeah, appointments booked, patients, like the show rate, when we're booking appointments, the show rate, conversion.
What kind of show rates have we typically seen on the appointments that we're setting?
Yeah, I mean, a few years ago when we were first starting out with some of these clients that we work with, it was, 70s, and now we've approached 80% or better show rates in some cases. And so we've seen improvements as we've refined processes. And I think from a standard, it should be 75% or better on your show rate expectations. And I think, obviously there's some things you can do to improve those, but when you have a good front end process, an outreach process, and where you're confirming appointments and you're establishing some good trust and rapport right out of the gate, I think that is the biggest difference that I've seen.
I think when you look at let's call it a sales funnel, it starts with the member list, and then from there it's members contacted, and then from there it's members converted, and then into appointments, and then from there it's appointments shown, and then from show it's the consults given. So ultimately what I think the payers usually care about is the total number of encounters off of that member list, so the shows from the member list, and those are kind of the steps that you take and the levers that you pull to ultimately get to that member yield, which is probably the end all be all.
Yeah That's good. I think that's good insight, because I think those are the things that, if you have a good service provider, they're going to help you achieve those metrics and help you deliver. Those encounters are most likely turning into revenue, right? And so that's if you're paying for a service for an appointment set, you want to have revenue coming out of that, and that's like the more business side of the experience, more than like the member star rating and service levels and things like that. Those things are equally as important and something that you want to have on your radar. So what kind of processes have we implemented to increase the appointment show rate? You talked about a few things there.
Yeah, I mean, in working with our clients and their providers as well, there's a number of things that we've done on the front end for sure, ensuring that the confirmation on the appointment is solid. So that's on our agent, ensuring that we've got the right member, we've confirmed who they are, we've ensure that the appointment time, the appointment day is agreeable, and just reminding them that there's going to be some sort of an outreach to confirm the appointment as it gets closer. So that's a very specific thing that we've done at Squeeze to be able to really increase the show rate.
The cadence kind of that we set up.
Yeah, we have partners that utilize us for confirmation calls too. So when an appointment is scheduled, so that they don't have someone going out and showing up at someone's home and no one's there, we'll do a confirmation call like the day before as a reminder. Right. I will say the show rate, a lot of that depends on our partners doing their job too. The show rate's a really good metric where our efforts meet our partners' efforts. So it's their execution on that supply chain. So we may do everything really well on the front end. If they're not able to execute and get people in the home, that show rate will drop. So we use that as, we talk North Star metrics. That show rate is a North Star metric for us because it directly correlates to our partner success.
One of the pitfalls to avoid is to not schedule too far in advance. And we've learned that over time. We've got a sweet spot of 2 to 3 weeks typically, where max you want to schedule. If you go beyond that, it can increase the no-shows or decrease your show rate. But if we stay within that sweet spot and the capacity equals the demand, then we're in good shape.
Yeah, this is definitely one of the trickier math problems that we have to solve on a daily basis. It's a real balancing act,
right?
With volume and quality in the healthcare space, especially.
With where things are at right now, where do you see things going in the future for healthcare appointment setting and things like that, Jacob?
Oh man, that's a good question. I think more and more, because you mentioned this kind of aging population that we have, I think more and more things are going to move digital in the healthcare space. I think that it will become table stakes to be able to get your doctor's visits digitally, to be able to get your prescriptions quickly and more efficiently, and to get your services where they can be provided remotely. I think that's a real opportunity for the providers because in theory, their volume should be able to increase in that way if they have good systems in place. But there's also a risk of being left behind if you're not buttoned up on the front end. We've seen a lot of it, even with like the semaglutide stuff. We're seeing people or companies contract with doctors to prescribe a medication, and then you go on the website and you place the order and it's delivered to your door. And that all happens very, very quickly. You also see TV ads for these types of companies too, where you meet with a real doctor and talk to them, and then they prescribe your medication and it's delivered to you. Similarly, that omnichannel feeling is going to be table stakes. That will be the expectation. And there's obviously procedures and things that can't be done remotely, but things like consultations and clinic, a lot of that in theory will be made probably more efficiently.
Yeah. Like I have prescriptions right now, and this is like sort of not something that we handle, but it's like I have prescriptions now where I go through and I have it set up like on auto refills and things like that. And the pharmacy will like start texting me and calling me. It's like Walgreens or whatever. They're like, hey, your prescription's ready. Come pick it up. And I literally drive by that pharmacy every day, but I just don't turn in there and pick it up. And like, I just wish, and I think they have a way where I can get it delivered to my house, but I tried to look into it before and it was like, it seemed kind of clunky and complicated. And I was like, just forget it. I'll just go try to pick it up. I'll try to remember the next time. And right now I have it sitting there waiting for me, and I've driven by there like 3 times this week and haven't picked it up. So
well, it's about convenience, right? Yeah. Like with Amazon and the way we're all now being kind of trained to demand convenience.
Right.
I agree with you, Jake. I think the digital channels and the digital approach is going to be more and more the way that consumers expect to be serviced, even with healthcare appointments and things that we've been talking about. Not only just prescriptions and delivery of drugs that we need, but obviously with appointments and engagement with a doctor or some other kind of technician that's going to help us. So.
Yeah, and I'm personally really bullish on our opportunity and like Squeeze's opportunity in the healthcare space, because in order for all of that to work, you have to have an engine that's generating those appointments and that's able to qualify them and schedule them and do it in a way that's compliant, white glove, and that optimizes your performance. And so I'm excited to see how this continues to happen, because I think as more and more of these service providers and plans recognize the need for that, our opportunity will continue to increase.
Let's talk about that for a second. Optimizing, I think something that we do really well. We believe we do really well at Squeeze, right?
Yeah.
That we have the ability to create the greatest yield, or get the most out of a list, or a set of member records, or information that we're delivered to do outreach on. We're really good at that, and we think obviously that we can help others, health plans, service providers, by engaging with them and doing the outreach, because of our ability to be really buttoned up with it, and the systems and everything that we have in place today. So, I think there's a huge opportunity there, especially with service providers who may not be as sophisticated, maybe don't have the systems, or don't understand how to do the outreach.
Yeah, absolutely. I think what you guys have said is right on point, and what we're going to continue to see is even more push toward meeting members where they're at, and providing service to them in a way that can be preventative and help manage costs and provide better experience for the members. And I think those are all good things that bring about better healthcare outcomes for the population that we have. But this has been a great episode. Great to have both you guys here. Good conversations around healthcare. James,
thanks.
You've been in healthcare for 20 years or something like that, in this space that you've done. And great to have your insights and thoughts here as we've discussed this today. So you've been watching the Juice Consumer Direct podcast. Make sure you give us a like and subscribe.
Yeah, let us know. Send in any questions that you have that you want us to cover, and we'll get to them.
Thank you.